I'm Tyler Mantel, CEO of TVP Health. My big idea is to make affordable medical devices widely available. We began this mission with our ventilator era. In March of 2020, our all-volunteer nonprofit set out to design and produce a ventilator at a significantly lower cost to hospitals. In only 2 weeks, we produced our first prototype and we named her Era. This month, we received our emergency authorization from the FDA, and with this authorization, Era can start saving lives. Now, COVID-19 may have been our wake-up call, but our vision goes far beyond this pandemic. Generic drugs have saved the US trillions of dollars in the last decade, and generic devices can do the same. We hope Era can, even in some small way, relieve the socioeconomic limitations of our healthcare system. The patients of our low-income and rural hospitals need this change. At TVP Health, our work is to make the next pandemic more manageable. And beyond that, it's to reimagine how more affordable technology like Era can allow healthcare systems, doctors, and patients to breathe a little easier.
I'm Cain, an elite runner for Tracksmith, and my big idea is to create more agency for athletes by pushing professional track and field to provide more stable, health-driven job opportunities for athletes. Currently, athletes sign unstable, purely performance-based contracts that value them as products versus people. This is especially troubling for female athletes who have their work as mentors and advocates treated as a detriment to their performance and therefore a negative to their value. Athletes have so much more to give the sporting world and their broader community than their athletic achievements. But to create a world where this is sustainable, athletes' health, both mental and physical, has to be protected by the very organizations that sponsor and employ them. To this end, I'm working on a model that structures athletes' contracts as traditional employee contracts versus independent contractors. Athletes will be awarded the same benefits of employees, such as company health care to have access to doctors and mental health therapists, paid maternity leave, and opportunities for continuing education. In return, athletes can take on serious roles within the organization they run for, such as working with marketing, branding, and product teams to better expand their own career skills. When the sports world begins to value athletes for their whole selves, then the industry will shift from win-at-all-cost cultures to a healthy sport model that can create champions for life.
Our shameful failure in modern medicine isn't the diseases we cannot cure. It's the patients we can cure, but fail to reach in time. Millions of people die every year as a result.
Our big idea is simple: cure delay in healthcare.
First, we must abolish out-of-pocket fees, which delay and exclude the poor. Every year, healthcare bills drive more than 100 million people newly into poverty.
Second, we need to bring most healthcare into the home, with technologies as new as rapid diagnostics and as old as penicillin. Patients shouldn't worry about who will watch over their kids when they go to the doctor, or about how on earth they will find transportation to a clinic.
Finally, we need to redefine the moral mandate of healthcare. It's time for us as healthcare providers to stop waiting for our patients behind the walls of hospitals. It's time for healthcare systems to stop preaching equity in word while charging fees that exclude, delay, and kill our patients because of the color of their skin, because of where they're from, because they're poor.
Making this happen will take all of us, because urgency is how we value human life. Speed is an act of love and justice. So we're here to recruit you. Let's cure delay together.